The treatments for cervical cancer are based on the stage of the cancer that we find. Early stages are treated with surgery. That can either be a simple hysterectomy or what's called a radical hysterectomy. And the radical hysterectomy in particular is the ideal stage for that is what's called a stage 1B1 cervix cancer. And that involves removing the uterus, the cervix, this region that surrounds the cervix called the parametria, and then a small portion of the vagina in order to get around the entire lesion or the cancer that's in the cervix. If we're able to do this, there's usually not any other treatment that's involved. More advanced types of cervix cancer are treated with a mixture of chemotherapy and radiation. And the radiation is delivered to the pelvis. Often we don't perform a surgery if it's going to be a more advanced lesion. There were several studies that showed that patients who had advanced disease actually did better by just having radiation and chemotherapy than if the anatomy of the cervix and the uterus were removed. The radiation oncologists use the uterus and the cervix as sort of a roadmap for how to deliver the radiation. Those patients had less side effects and better quality of life later on. So it's very important sometimes to figure out how far the cervix cancer has spread so that we do the right treatment for the patient. And sometimes that's surgery, and sometimes that's a mixture of chemo and radiation. And that's one of the things that at an appointment we try and sort out before making those kinds of decisions. We're guided by that with CT scans. Sometimes we'll use a PET scan, and then also the clinical exam.